The VEST Airway Clearance System Model 205, an innovative therapy device designed to administer automated airway clearance therapy across the continuum of care. It's been proven effective in mobilizing retained secretions for patients suffering from both acute and chronic respiratory conditions. This tutorial program is designed to give you an overview of the features and functionality of the VEST Airway Clearance System, including basic setup, use, and maintenance of the device. For further information, please refer to your Model 205 user manual. The VEST system is mostly comprised of three major components: the air pulse generator, a pair of connector hoses, and the VEST garment itself. For better infection control, the VEST garments were designed for single-patient use. Latex-free and disposable, they are available in a full garment style or a wrap garment style. Both are fully adjustable for optimal patient comfort. The hoses connect the garment to the air pulse generator and are also available in a disposable option for treatment of patients with infectious conditions. The air pulse generator displays therapy settings and remaining treatment time and is programmable for customized treatments. When they come together, they deliver a specialized type of airway clearance therapy known as high-frequency chest wall oscillation. Through rapid inflation and deflation of the garment, the chest wall is gently compressed and released, which creates airflow within the lungs. This process moves mucus toward the large airways, where it can be cleared by coughing or suctioning. The VEST system is prescribed for a wide and rapidly growing number of diagnoses. Treatment indications include secretion retention associated with impaired ventilation and/or gas exchange, ineffective cough or secretion clearance due to immobility or muscle weakness, and airway clearance dysfunction resulting in thick, sticky mucus. The VEST system is proven to be effective in the delivery of consistent airway clearance therapy for the treatment of these conditions. For full indications and contraindications for the VEST system, please refer to the user manual. For easy transportation, the air pulse generator rests on a mobile stand with 4 locking caster wheels. You can raise and lower the unit to a comfortable working height using the adjustment lever. An onboard storage basket makes it easy to have extra disposable vests on hand anywhere the air pulse generator goes. To fit the wrap vest, roll the patient onto their side and slide the disposable vest under the patient just below their arms. Roll the patient back and pull both ends of the wrap vest around the patient's chest. Attach the ends of the wrap vest so it fits close to the body and can still be comfortable. A flat hand should fit between the body and the deflated vest. The disposable wrap vest reduces the risk of cross-contamination and is particularly effective in treating post-surgical patients, mechanically ventilated patients, or patients with body types that make fitting a garment challenging. To fit the full disposable vest, position the garment behind the patient and attach the shoulder straps to the front. Adjust the shoulder straps so the bottom edge of the full vest is at the top of the patient's hip. A closed fist should be able to fit between the patient's chest and the deflated vest. Next, make the hose connections between the air pulse generator and the vest garment. Push one end of each hose into the connector ports using a slight twisting motion. For the disposable wrap vest, pull up the tab and push one end of each air hose into the hose slits. Insert approximately 2 inches. If necessary, secure the air hoses to the side of the wrap vest with the attached loop. For the disposable full vest, push the other end of each air hose over the full vest air hose ports, using a slight twisting motion to help keep them in position. Please note, it's very important to make sure all hose connections between the garment and pulse generator are set and secure before initiating therapy. Failure to do so could result in serious damage to the equipment. When the VEST Airway Clearance System is first plugged in, the unit goes through a self-calibration, which may take up to 15 seconds. It will then display the software revision number and the hour meter reading for 10 seconds or until the on button is pressed. Cross-reference the software revision number in your user manual for instructions on programming customized therapy settings, such as ramp mode. For quick and easy starts, use the normal mode. To do so, simply press the up arrow button above Normal. The display will then show the 3 key therapy settings last used on the device: frequency, pressure, and treatment time. Press the up or down arrow buttons above and below each displayed setting to match the patient's therapy prescription. Once the correct settings are shown, press the On button. The garment will inflate. Press On again to begin the therapy session. The pulse generator will gently begin sending air pulsations to the garment. Your remaining treatment time will begin to count down on the display. When in normal mode, you may change your treatment settings while therapy is underway. The air pulse generator does not need to be paused or stopped to make setting adjustments. You may pause treatment during a session at any time. Simply press the Off button once on the pulse generator. The unit will stop and the vest will deflate, but the remaining treatment time will continue to be displayed. To resume, press the On button. This can also be controlled by the patient or clinician with a single press of the optional remote control. If it's necessary to end a treatment session before it's complete, press the Off button twice. The display will indicate that the therapy session was incomplete and display the number of minutes remaining. To return to the main display, press the On button. When the therapy session is concluded, the air pulsations will stop and the garment will deflate. The display will indicate that the session is complete. Disconnect all hoses, remove the garment, unplug the pulse generator, and store all components appropriately. The VEST Airway Clearance System also offers custom therapy modes. Ramp mode gives you the ability to ease the patient from a lower setting to a higher setting during a percentage of the therapy session. Program mode allows you to create 2 separate custom therapy sessions, each with up to 8 points at various settings within a single therapy session. With the Cough Pause feature, you can schedule reminders for the patient to cough at desired points during their therapy. Detailed instructions for using these features can be found in your Model 205 user manual. The VEST system requires no routine maintenance. Follow your institution's guidelines for cleaning reusable equipment. Wipe down only the outside of the unit between patients or when soiled, and never immerse the disposable vests, air hoses, or the air pulse generator in water or any solution. Avoid excessive moisture or use of harsh cleaners. Only authorized representatives should service the VEST Airway Clearance System. With an experienced and dedicated staff ready to serve you, you can expect the highest level of customer service for your VEST Airway Clearance System.